So I wish you now a pleasant flight on board of the EU-JAMRAI 2 online, and our first stop of our journey will be on accelerating and translating priorities into impactful AMR priorities. You know what I've learned from EU-JAMRAI 1, because I was also the coordinator of EU-JAMRAI 1, and what I've learned from this exciting experience is that it all begins with commitment and political will. Countries establish policies, dedicate resources, and align strategies. Because reducing AMR is not just a local effort or a national effort, it is also a European collaborative responsibility and a priority that required shared values and political engagement. 30 countries are aligning their strategy under EU-JAMRAI 2, creating a strong foundation for One Health collaboration. So we start this session on policy engagement, policy commitment by welcoming Mrs. Hannah Sjöblom, Director of REACT Europe, for a short keynote on Beyond Plans and Promises, how to make action on antibiotic resistance really happen. Thank you, Anna. Thank you very much.
And I promise not to press the black button. No, it's in here. So, good afternoon, everyone. I'm so happy to be here today, and especially to be in Europe today. It's been a turbulent week, and it's been a week where I think joint action in Europe has been felt much more than in many other weeks of the year. So I'm very much looking forward to hear how that is concretized in the field of antibiotic resistance, and also to work across disciplines, because I think we know quite well with who to work with together. And I also think the solidarity between our countries has become stronger, as well as also that we still stand for Ukraine and for freedom and human rights and democracy. So we live in a world where these foundations and global collaboration and solidarity is severely challenged. Last year we saw how several global health threats were becoming more severe, at the same time as, including antibiotic resistance, and at the same time where health financing was decimated and bringing health systems really to the brink of collapsing. So in the political development that we've seen with the Trump 2 administration, not only exiting US from numerous global initiatives, turning away from the rule-based orders, undermining multilateralism that has been built over many years, making us needed to be prepared for situations that we didn't think we needed to be prepared for. But working in antibiotic resistance, we already showed that it's possible that despite geopolitical divides, we can get things done in this field. And I'm thinking of the many disagreements that were around ahead of the UN high-level meeting in 2024 on AMR, where the political declaration was signed by all member states in the end. And also another example of the pandemic agreement. It was not perfect. There was a lot of countermeasures that could have been put in place and more equity felt in that document, but finally it was agreed on. So we do know that we, as European countries and in this region, we need to both lead by example, doing the work on national level, on EU level, but we also need to commit for the global fight against antibiotic resistance. So we'll need to do that by showing what can be possible, but also supporting countries that are not have the possibility and not the resources that we have to actually work consistently in protecting antibiotics for the futures. So, and I think EU-JAMRAI is a great example, as I said, and I also think that organization like REACT can come in and support in this work. So I've been asked to talk about how to make action happen. And I represent REACT, Action on Antibiotic Resistance, so I should know that. But also JAMRAI has action in its name, so you're also the experts here. How do we make it happen? I mean, for me, I'm a nurse. I graduated 25 years ago, and my first commitment when I thought of action was towards the patients. I came out and worked in infectious disease ward when MRSA, we had huge peak among patients. And we actually did not have the routines and policies really in place locally. We had to create them as we went or adapt them. And also there to be able to comfort and explain to patients what these 4 letters meant and what kind of consequences they could have for themselves and the family, as well as protecting colleagues from infections and making sure that we uphold a safe environment for patients. Later on, I transited into humanitarian work, and action on antibiotic resistance there could be like, protect that small child from infection and making sure that even if we had to submit, 50 more children in one day in one ward, we were trying to continue to work according to infectious diseases and control practices. And, the matter of spacing the beds from a distance, run to the market and buy soap, that was also action on antibiotic resistance at that time. Then moving away also from there, realizing that actually to be able to save the life of that small child with severe acute malnutrition, there was a whole cascade of actions and things that were needed to happen to save lives. So it's much broader than the few meters around that hospital bed. So then, policy change and also to be able to also point to the responsibility of others is also action in this field. So, REACT, a couple of words about us, for those who don't know REACT. We were founded in Uppsala University 20 years ago, but with an ambition, and actually we were global from the first day, I would say. It was really a network that wanted to create change on national and local and regional level. And we have then worked both with government and institutions to write up the first national action plans and also to help to implement them, the revisions of the national action plans. But we also, by showing by doing, had quite a few pilot projects and projects on community, in communities and in schools, and also a lot of awareness raising and policy to change. So REACT Europe, where I've covered the role as director for the past 4 years, based at Uppsala University, we've been actually been acting in several processes at EU level to shape the agenda, not the least around research and development, where we have seen quite a few changes over the past years. But also since last year, we actually have a project together with Ukraine as part of implementation of the national action plans in Ukraine, and specifically focusing on IPC systems, knowledge and awareness. And we do this with close collaboration with the Swedish Public Health Agency. And I also want to take the opportunity to say that when we're talking about going from knowledge to policy to action, I think Ukraine has shown an extraordinary strength in this and determination to implement your national action plans amidst a situation of war after the full-scale invasion, and where actually health systems and all institutions are under extraordinary challenging conditions. So, what do we do then? What are the recipes? What is the recipe for moving in this field? So, I think where implementation can take place, both top-down and bottom-up, and also through mixed approaches. And I think that is what you have really good examples of here. From REACT's own work, we've been part of several top-down processes, such as national action plans, as I mentioned, revision and rollout, and specifically in LMIC through the partnership with Swedish Development Cooperation Agency, SIDA. And what we have seen here is that it's important to really break down these very big and comprehensive plans into actionable steps, and also especially in countries with limited resources, to actually know where to start, to prioritize. Also on the bottoms up, on community-based approaches, we have developed several ways of working for one example that I can mention here is on Alforja Educativa, which is a guides that encourage children to discover and learn and communicate about health-related topics in a playful and artistic methods. So this was started in a local project in Ecuador and is now actually taken up by more than 7 countries in Latin America, and also being implemented and integrated in curricula for schools. So we've also been part of developing something called Antibiotic Smart Sweden that we might have the opportunity to talk a bit more about later, together with Public Health Agency, RISE Research Institute of Sweden, and Strama. And here is really a vision-driven approach to engage all of society and motivate different actors in Sweden to participate in AMR focus, and through criteria, they can become antibiotic smart. And this is, if you're interested in these ways of working, please reach out after. We would love to do this, together with another European country at some point. But it brings me to the next point, actually, and it is context and interpretation. And here you represent more than 30 countries, I heard. So I guess even there's a lot of, things that brings our countries together. There's also great differences also within EU countries. And I think here, it's key to adapt policies to context and do proper interpretation. Even the best policy in the world can fail in practice, and we can just not apply things from one place to another. We really need to recontextualize it and negotiating and adapting to local norms and constraints and goals. So one example that I can share here is that the Alforja Educativa project that we thought that we could implement in Kenya and Africa, it just needed to do a quite big revision for it to be applied to what would work in a school context in Kenya. So this is therefore important to involve frontline professionals and to really engage everyone who is also going to work according to these principles, and to give, time, space, mandate, and to apply this. Next thing I would like to mention, and I think it already have been touched upon, is like to build capacity, support, and infrastructure for change. So REACT has been able to support capacity building in these interfaces in many low and middle income countries, and also then here a picture from Sweden. And both in terms of from science to policy steps, and the following one, we need to support research and research team in interacting with policymakers and in policy arenas. So we can do that with trainings directly with ministries, or guiding on how to integrate new tools and guidelines and all that. But it's really the system that needs to be strengthened. And specifically here, I can mention the funding issue, that is not only an issue for low and middle income countries, but also here that you can have a process finance all the way through developing everything, but then, the rollout sometimes is forgotten when it comes to budget lines. So, then, hold on one second. So enablers, there's sometimes, I would like to say, we need to treat implementation as a process and not an event. So we see several successes of this also outside of Europe, but there are often times when we sit and they think like, okay, we did everything right. We have defined all the steps, but we still, it just doesn't take off, What is missing then? And you mentioned it already, the political will, the commitment needs to be there. And political will is just not a magic. It's just not something that happens like that. It's not a mysterious force. It needs to be built. And last week I joined the Gates Nordic Gatekeepers event in Stockholm, where Bill Gates attended, and the Swedish Minister of Health, Jakob Forssmed, he is the vice chair also of Global Leaders Group. And he mentioned, you know, once you have understood AMR, you cannot un-understand it. So like if you get it properly explained to you, and this time it was actually by the founder of React, Otto Kar's professor, who he invited in the first week of office, you are then stuck with it. You cannot not act on it. I'm not sure if it's totally true for everywhere, but I like to think that it is so. So it's really up to us to really explain the issue of antibiotic resistance, and also do it in a way that is actionable. Because politicians and decision makers, they don't really understand this with abstract warnings, and maybe like things like multi-sectorial approach needs to be strengthened. It's just not going to resonate. So we need to do something more. And the fact that the minister himself brought up, you know, newborns and also cancer care in his speak, it tells us something, that we need to be concrete. And I know I have very little time left, but I want to say that here, the examples for this morning with art exhibition can also be a way to get to that part, you know, the understanding that goes beyond. So when it comes to the other thing is the champions. And I think the way that this meeting was open with, you know, with the backbone, the brains and the hearts of people in the room, champions is just not the ambassadors, it's everyone. And I think sometimes you know that you need that person with the stubbornness and the energy to get it done. And that you need to find that and collectively create that force together. And I think like for React, this is what we like breathe of, you know, we have like for React Africa, for example, it sits that energy also in the faith-based organizations, or in Asia, it's really in the youth, and in Latin America, in the social movements, and here in Europe, we feel like it's all across the One Health spectrum, actually. So I think that, you know, to continue to be that backbone, brain, and heart would be like very important, and we're happy from React to be part of that going forward. So really looking forward to the next part of the meeting, and thank you, and sorry for taking one more minute too long.
Thank you. Thank you very much. Thank you very much, Anna, for this inspiring word, really. And let's continue. And now we now hear about the EU-JAMRAI 2 actions from the teams leading the country's engagement actions. And I first call on stage Benjamin Davido from the French Ministry of Health. Where are you, Benjamin? Here.
Thank you, Marie-Cécile. Thank you, everyone, for being here, and thank you to the previous speaker for this excellent overview. And I'd like to add that as an infectious disease specialist taking care of patients suffering from antimicrobial resistance, all we are doing today and during the ongoing weeks and thereafter is very important for me. I'm very proud to be here with you today. And I know that everybody here is engaged in a way about AMR. And so, as we said, dissemination, communication is very important. And if we are here, I think that our main goal is that what we will learn today will get disseminated outside of this hall and outside of this city and everywhere in Europe. So maybe before just we start, we can go, yeah, I know I don't have to press the black button, which is the black swan as far as I understand. So normally, I don't know if you see my slide, there is a special, which is the current slide, no, sorry. The current slide is this one, what are you, yeah, no. So I want to go to the next one. So we have this particular menu from the chef today, as we are French. And in this session, we will showcase you how EU-JAMRAI 2 can truly act as a vehicle. And you will see my particular vehicle. I like cars, I must say, especially German cars. And we want to accelerate this action, as previously mentioned by Marie-Cécile, if we want to fight properly antimicrobial resistance against across Europe, sorry. So we will focus on then how to accelerate our national action plan action and how to implement and increase our impact together. Then the team responsible for evaluation will showcase the impact of our actions, and we will go and highlight why sustainability matters before closing with remarks and maybe, if needed, with some questions and obviously answers. So, setting the scene, just to say, I won't repeat what Marie-Cécile and others just previously said, but AMR affect in a certain way all of us, not only in humans, but on every sectors. And no country is spared, as you might know, even outside of Europe. And that's why we are here today. And as you will see, there is no shortage, no shortcut. So we have to hack together to challenge AMR. And we have to move from intention to implementation, and that's why I think we're all doing here. So what we proposed here was the slide, if you were familiar to it, and were in Bilbao last year, we showcased in 2025. And I'd like to bring you back to what we presented last year in the General Assembly, where we introduced this bridge, that I hope you do remember, and which was, the main purpose was to illustrate how we were all connected together. And the key message was that turning outcomes into national action plans and policies requires strong memberships, engagement, robust evaluation, and long-term sustainability with all relevant actors working together and stakeholders. So this bridge represents the pathway from shared work and evidence to concrete national impact. Here is the timeline of AMR over time. I think this slide, maybe you know it, is very important. It's illustrated from our French national agency and has been translated. And I'd like to take just a minute and go by it and provide you a little bit of context. This timeline clearly reminds us that AMR is not a new phenomenon. It has evolved alongside every major antibiotic discovered has been affected by AMR. Almost a century after the discovery of penicillin, resistance emerged quickly, and we've seen the same pattern repeated over and over across all antibiotic classes, and unfortunately, more rapidly over time, even within a decade. And this is obviously a bad news for the patient we're treating. And as far as I remember, antibiotics were discovered in 1928, so we're approaching the century, and we need to find solution to an alternative to antibiotics. At some point, there is even hope that infectious disease, as you can see, might disappear and will vanish. Today, we know that the reality is the opposite. AMR continues to spread, and the global forecast for 2050 is extremely alarming, is not so good. Our objective here is precisely to change that trajectory and to act early enough to avoid that scenario where infectious disease could become the leading cause of death, while now it's a cardiovascular disease. So what we propose for 2026 for this General Assembly? We are keeping the idea of this bridge that was quite working well, and we are upgrading the metaphor. This year, we invite everyone to embark in our time machine using not a German car, but a DeLorean, inspired by the movie that you might know, Back to the Future. The car is powered by 3 enablers, which are the member states' engagement, sustainability, and evaluation. And of course, as you can see, there is a clear AMR ambition depicted by the AMR symbol. The idea is simple. We want to ensure that the outcome of the JAMRAI 2 across antimicrobial stewardship and embed also infection prevention control, surveillance, access, communication, and they are not only produced but truly implemented at every stage and every level, and obviously at national level. So, as you will see, there is an animation, and as the door opens, we are bringing the JAMRAI outcomes on board and driving them straight toward to a better future. So here we are. And now you see that the machine is accelerating, moving forward and reinforcing collective efforts to reach our 2026 objective through concrete action on the ground. After 2 years of work, we now have strong foundation and we are coming together to increase our impact. Our ambition is not only to slow AMR, but we want to push resistance level back to what we've seen before decades ago. That's why we showed you this timeline. And just like in the movie, you see that the car just disappeared. So where is the car now? Because we're trying to change the timeline, we're now embracing, and where AMR has followed too far and too long ago. So actually, we are on the other side of the bridge, and now we are now facing in 2026 a new timeline with new milestones. And you can see that the next one is in 2030, 2040, and 2050. Today, the challenge remains a widespread circulation of resistance, including multi-drug resistance organisms and extremely drug-resistant organisms. That's how we call them in Europe. But what we want to show here is that there is a different future possible. By 2030, we aim to see a major reduction in extremely drug-resistant organisms in line with current European target. And I think this is very important we achieve them. And beyond that, with the actors we are developing and supporting at national level, we believe that we can significantly reduce widespread resistance by 2040 and beyond, and ultimately counter the most pessimistic scenario for 2050 in a sustainable manner. So thank you for your attention, and I think I give the floor to Corine.
Thank you, Benjamin, for setting the scene. And I have to say, it's a beautiful scene. It helps us in knowing where we came from, but it also shows us where we need to go. And you have been introduced to the car, which is, I have to say, it's been beautifully designed by Benjamin. He gets all the credit for this. And it was his brainchild, but we embrace the brainchild because we think it's a very good metaphor. And it's an upgrade of our Bilbao bridge that we had before. But how are we going to drive this car? I mean, it should be big enough for all of us to be in it. So we are using JAMRAI as our driving force to accelerate our work. And I have to see now which slide I'm going to be on. Yes. So we're sticking with the metaphor of the vehicle. We're going to be using JAMRAI as our vehicle to move things forward and to accelerate our impact. And the potential is huge. JAMRAI's potential is huge. The foundation has been laid, the bridge has been built, and all we have to do now is move forward and to really start implementing. And this word has been used a lot, but we are at the halfway point now of JAMRAI, and this is really where we are. So it's time to hop on the car and drive. But the big question is, how are we going to do that? So we want to start by giving you an overview of the playing field that we are on at the moment. So we've seen JAMRAI has a lot of potential. We have heard backbone, we have heard brains. We have a lot of this brain power in this room right now. And we're going to show you the playing field and the elements that we can see here. So we have budget, which has been also indicated by our coordination team. There is budget. As Work Package 5, we have indicated policy priorities, and we have identified 2 policy priorities per country that we are working on. The other elements on our playing field are the liaison officers. They have been mentioned as well by the previous speakers, as really are sort of not the people that have to do all the work, but very instrumental people in our work packages. The other elements of our national playing fields are, of course, the policymakers. And the liaison officers are the ones that have to find the connection with the policymakers. And importantly, then, the next step to take is to make sure that the intersectoral coordination, the One Health elements, are really reaching the decision makers. And this is obviously the bottom-up approach that we are working on. And ultimately, this will lead, hopefully, in an ideal world, to development and implementation of an AMR NAP. And I think actually this is, the graph is upside down, because I think we redesigned the graph so that everything would be the other way around, where the EU Council recommendations are the underpinning of our framework. So you just have to like turn it around, put the Council recommendation at the bottom, and then work your way up towards the national implementation, the implementation of the AMR NAPs. Yeah, so I think that would be my part of this presentation, and I hand over the floor to Karina. And I do hope we have the rest of the slides that are not the old ones.
Thank you so much, Corine, for bringing this context. And also, what we need to know is that we have a window of opportunities, we have tools to bring national implementation into action. So here we want to outline those. So JAMRAI has provided us with a strong network of expertise and resources across Europe, and the protagonists of this network are the liaison officers in each of our countries. They act as the link between our project and the national policy processes. We also count with the policy group, which is here to connect the policy officers and the governance across countries. Finally, we understand that one size does not fit all, and even though AMR is a shared challenge, each of our countries require a tailored approach and a particular way of tackling AMR, and this is why we have brought the support program to help policy officers and to help countries in a tailored way to tackle this. So now, when we go to the first element and the protagonists of this, the liaison officers, as we like to call them, a spider in the web. Who they are of course an important element of an implementation. They are the link of Work Package 5 and the National Action Plan of each country. They are also the key connector of the JAMRAI and also the ICMs and the national decision makers. The liaison officers are also the linking point between the JAMRAI and the technical work packages and the countries. And they are here, of course, for facilitate the alignment of their countries with the EU Council recommendation. And now I will give the floor to my colleague, Giel.
Well, thank you. I'll be touching upon something that was beautifully introduced by Mrs. Weiland actually already, so I can keep my slides fairly short, I think, of my presentation. I will follow up my this slide actually, the one that I'm showing you right now, on Karina's introduction of what the liaison officer is, because those, let's say, spiders in the web, right, come together every 6 weeks, as already mentioned, really to form this strong network of people collaborating. We do face a lot of different challenges, a lot of different needs, but only together we can actually try to tackle this. So we try to make, we build with Work Package 5 the foundation of all those people working together within this policy group. The representatives of the policy group are of course the LOs, the spiders in the web, but we also make the connection and the link with the technical work packages, with the European Commission, with the national decision makers that are not officially part of JAMRAI, really to again form the fundaments of this collaboration, share best practices, come together and learn from each other, which is, as we all know, as for now, very important since we are facing a lot of challenges, even within our own capacities. Within the network, we really do see that the involvement of all One Health sectors is a challenge, especially when it comes to the environmental sector, something we really try to encourage as well. We really do have limited time, limited people. There are some of us, including Benjamin, I believe, who is working at the hospital for 3 or 4 days a week, and with this one available day trying to help us. The position of the hierarchy of the liaison officers is a challenge too. We really do see that there's a lot of potential. This potential is seen by us, is even seen by the European Commission, but sometimes is not really seen by the people higher up in the hierarchy. And at the same time, we also, of course, see the lack of political awareness. There's a lot of more challenges our world is facing, which could sometimes in some member states result in AMR being low on the political agenda. A lot of challenges that we are trying to not cover, but at least play a quick, small role in. Which we're doing with the support program. So based on all member states' needs and challenges, translated into 2 national policy priorities of all member states, we built a support program, again, to tackle those needs together. A great example of one of the actions out of the first module of the support program is the AMR policymaking course. That's the most general module, let's say, of knowledge enhancement, things all people joining the policy group could benefit from. We are organizing this policymaking course for policymakers, but also for experts in Berlin in March. So if there's any more people that want to participate, please let us know. The second module is a more tailored one, so based on the clustered or bundled needs of the member states, we are offering tailored support in thematic working groups. And the third one is the most tailored one and is support offered by Work Package 5 on a very individual base. So individual member states requiring policy needs or help from, again, the policy from a Work Package 5 perspective. So again, there's a foundation, we have a network, we have money, we have the LOs. So the foundation was laid, and now it's up to us to make this network that is there even stronger, to really support all together, also with the stakeholders, all the important LOs, and to really use this available resources to implement and develop our national action plans. Thank you. I will now give the microphone to my colleague Nerea from Work Package 3.
Thank you. So, as our colleagues have already shown, the potential of EU-JAMRAI 2 is vast. Many activities have already been carried out and many more yet to come. So now it's time to showcase all the impact of this potential. So in this context, we feel that evaluation can serve somehow to ensure that our activities are aligned, remain aligned with our objectives, and also that they generate the tangible impact we intend to see. So at the beginning of, at the onset of the project, we defined an evaluation framework, including the indicators. We collectively define our indicators. We already defined the monitoring methodology for these indicators, and we also included the approach for the impact assessment, both during the project and beyond, of course. And importantly, we took into consideration the needs and preferences of our main key actors, our target audiences. So once this evaluation framework was defined, then we implemented a systematic methodology for the indicators tracking. So this is mainly consisting of tracking, again, our main outputs and the related results. I mean, all the activities that we plan. So with these foundations in place, and now that we are in the second half of the project, so now it's time to measure, to demonstrate the impact of these activities. So to this end, the evaluation team has worked on 2 main key actions. First, a stakeholder consultation process, and second, an internal reflection about the impact assessment. So for the first key action, now I'm giving the floor to my colleague, Ismael Martinez.
Thank you, Nerea. Thank you, Nerea. Thank you so much. So based on our evaluation framework, we have 2 different approaches. The first one is a quantitative approach. It's more like a dashboard showing where we want to end up at the end of the project. But we have also another approach. This is the qualitative approach. And for us, in this project especially, is more like the fuel for the DeLorean to get or try to improve the implementation processes and speed up the project in the following 2 years and beyond, if possible. So talking more about this quality approach, we have conducted 3 different focus groups with different stakeholders. You have the methodology of the focus groups, and I will explain a little bit more that. So the first focus group was addressed to policymakers, liaison officers, and representatives from different ministries of health in Europe. And the second one was addressed to IPC and AMS stakeholders, also from around Europe. And finally, we focused our effort in a focus group dedicated exclusively to the sustainability of the project, with representatives from DG Santé, EFSA, and the University of Antwerp. The most important point here is that the moderation guides were co-created with experts in policy engagement, sustainability, and IPC and AMS. And we kept the One Health perspective as an overarching theme in all of the focus groups. So I will take advantage of this forum to present some preliminary results. We are still delving into this information. In the following months, we expect to provide more information, but at least a glimpse of the preliminary results. So for the first focus group, the policy group, those representatives have a sort of top-down approach because they are at high level in the system, and they provided information about many gaps they see, obviously, in the at governance and the high level of the system, but also they refer to disconnection among sectors and among actors. So it's not only among the human, animal, and environmental health, but also at different levels and different parts of the system. That was interesting because they were concerned in reaching out lower levels of the system, in filtering down the policies and get implemented somehow. So when we talk with the APC-AMS stakeholders that are in the field and are those have sort of bottom-up approach, the first thing they said was that the project was perceived as successful, or at least they are, the EU-JAMRAI is providing useful tools, and they perceive gains in some fields, in IPC and AMS, in animal health, veterinary, and even in the behavioral change model. They see that there are a lot of potential and is useful, our EU-JAMRAI project. But also they refer to barriers, obviously, and there are many that are structural. Some of them refer also and mentioned in the policy group, but they were mainly concerned about the sustainability of the actions and the tools beyond the project, after the project ends. So let's see the sustainability group. This sustainability group is, interestingly, is having a middle ground in between, and they provide very insightful topics. They also identified previously barriers because they are quite informed of the situation, but they propose solutions for the main priority outcomes in IPC, surveillance, and access to antibiotics, because we purposefully asked them about that. And when you see the whole picture, it seems that there are some convergence, at least in some common strategies. So I will try to show a big picture, taking into account the 3 focus groups altogether. So we have internal and external drivers. From the external part, we have the policies from the EU Commission, and that exert pressure in policies to get implemented, but also there are the public opinion that with that bottom-up approach is enacting also policies, and is quite important for politicians. So it's like a catalyzer also for policies. And we have some cross-cutting barriers. The most referred ones are the limited funding, human resources shortages, inter- and intra-country variation. So there are some levers of the system that can cope or could cope against these barriers, such as binding budget and responsibilities, policy frameworks that encompass and integrate, get together human, animal, and environmental fields. Also, political will, ownership, and leadership should appear there as levers of the systems. And we identified a sort of broad group of strategies. They are intertwined, interrelated. They are targeted communications. There are many opportunities that are not considered to influence key actors and stakeholders. And there should be some alignment of priorities that is not always taken into account. They are intertwined. They are also interrelated or closely related with political will, leadership, ownership. And finally, at more local level, we need to identify new formulas to translate evidence into practice. And the tools that are already provided in EU-JAMRAI that are standardized to get a common floor for all countries should be adaptable for local contexts and different countries. And all the three focus groups identify the environmental field as a challenge that is not solved, is not overcome yet, but we are still delving a little bit more in the qualitative analysis we expect to provide some extra information about that, and that would be the results so far. So I will give the floor again to Nerea to explain a little bit more about the impact assessment. Thank you.
Thank you, Ismael. So the second key action that we propose from the evaluation team is an internal reflection methodology about the impact assessment to bridge the gap between our activities, our daily activities, and focusing on the impact, on how to measure, how to demonstrate the impact of all the activities we are doing. So on the upcoming months, we will contact you all, to the partners, to make this together, this reflection around these 5 main questions that you can see here in the slide, I hope. Yeah. So these 5 questions can be summarized in 3 main steps. First, defining the target transformation. So now we have to define the what. So as a consortium, the proposal is to answer the question of what systematic change do we intend to see. So this means identifying the shifts in the AMR landscape that should persist long after the project concludes. Second step, the stakeholder-centric evolution impact driven by people. Marie-Cécile has already shown at the beginning the numerous stakeholders we are working with. So together with our stakeholders, the question that we propose to answer is, what specific behavior needs to change in these actors? So by defining this evolution, we somehow ensure that we are working with a purpose. And third step, indicators of success and attribution. So the proposal is to define a working plan, specifying mapping activities to these outcomes, to these desired outcomes. So we need to define the evidence of change. How will we verify objectively that these changes have happened? So here we are talking about establishing thresholds of success somehow. So these 5 questions and these 3 steps, the main goal here is to ensure that EU-JAMRAI 2 drives the sustainable change we promised, we think of at the beginning of the project. And to explain this work on the sustainable change, now I give the floor to Marie Fuentes. Thank you.
Okay, so having discussed now how we are engaging member states and how we are evaluating the impact of our activities, we will now turn to the question, which is how do we make sure that the efforts that this consortium is putting out will last and will continue to make a change against AMR over the next decades. So why sustainability matters? Because we are planning for long-term impacts. When we consider the scale of the burden of AMR, which was presented by Benjamin, and the level of investment that has been made by European countries, by the European Union, and by this consortium, we realize that this is not just a time-limited project. We do not see the JAMRAI as a 4-year initiative, but a long-term commitment with, like you said before, over 120 actors involved in Europe and beyond. So in reality, we do not have 2 years left, but we have 2 years to make sure that what we put out now will continue to exist, to function autonomously, and to create impact beyond 2027. So that is what sustainability really means to us and what we are trying to achieve with you all present today. So this is just to provide you with a reminder of a methodology to assess and reinforce the sustainability of our action. In the first stage of the JAMRAI action, we developed a sustainability guidance tool, specifically for this joint action and specifically having in mind the governance of AMR. So this tool aims to support the identification of what we call priority outcomes, while also assessing their implementation challenges and limitation at national, EU, and beyond level. So, like I said, its objective is really to identify the gaps and the needs, and in collaboration with the work package leaders present today, we will develop a consolidated roadmap that will form the basis of this joint action sustainability report. So this is where we are today. So this is a quick update on the project's priority outcome up to this day. For the process, we have led the first rounds of exchanges in spring of 2025 and have given feedback to the work package lead over the summer to help refine them. So today we have 7 priority outcomes identified, which is bringing us closer to our target of 10. Our goal with this work is really to pinpoint key outputs and outcomes, drive their adaptation by partnering countries at national level, ensuring that the work that we all put together will last through their implementation in national action plans. Okay, so where does this lead us? This is a glance at the priority outcomes. Of course, this is a teaser. You will hear more about all the wonderful initiatives throughout the next few days. But in AMS, I will start with AMS, the consortium has identified the main outcome to be connecting professionals across the EU through mentor-mentee schemes and to support them through shared educational resources and science-led guidelines. For IPC, the project seeks to establish and promote the uptake of coherent national and EU frameworks across human, animal, and environmental sectors. That is backed by tools, training, and behavior change approaches to ensure long-term implementation. Surveillance efforts will reinforce a coordinated One Health monitoring system, including reinforced AMR animal monitoring via EARSVET. Also annual integrated national reports, and a living human sector dashboard, providing key AMR indicator for decision makers. On access, the initiative will aim to secure government commitments that extends beyond project duration to strengthen the availability of selected priority antibiotics as well as veterinary vaccines. And awareness-raising activities will focus on sustaining EU-wide One Health communication frameworks that fosters cross-sector collaboration and embeds AMR messages into national and European initiatives. Across all priority outcomes, we have identified several recurring challenges, highlighting where our efforts needs to focus on. For formats like online platforms, the main issue seems to be ensuring that the key platforms that are created stay updated and relevant once the project's funding mostly ends, it causes an issue of how do we safeguard all of the work that we have put out, the webinars, the training platforms, the documents, the guidelines, all of this. With regards to human networks that we were created, it all comes down to the human factor. We mentioned the HR resources, but it's also how do we keep people engaged? How do we keep the communication going? How do we have people finding the time when this time is not being allocated to us anymore? On training materials, we face the challenge of remaining accessible and integrated. How do we combine the structured programs with the peer-to-peer learning and the shared platform in a way that it is accessible to all and at all times? Because obviously we have gathered a collective today, but there are professionals in the next few years that will need these resources to be accessible to them. Lastly, for surveillance networks, the success will depend on clear mandates, as well as strong engagement, both from countries but also from international organizations. Who will be responsible to run these networks, and how do we make sure that surveillance data keeps on being updated and brought up to these tools and networks? So it is through answering these questions that we'll ensure that the dashboards and the surveillance tools will remain effective and actionable. So all these challenges that we have identified so far underline the importance of collective action. The revision of the priority outcomes over the next few months will address them, and achieving lasting impact will require collaboration with all of you present today. So as we move toward long-term sustainability, our focus is on making these priority outcomes last over time. Over the next 2 years, we will use a 3R strategy, which will consist of us revising, revisiting, and refining the priority outcomes so that they remain relevant and actionable. We will be strengthening our engagement with public authorities to support the uptake and address the barriers that we've identified in the next few months. Policy briefs will be a powerful tool to elevate these messages at the political level, turning technical work into strategic action. Lastly, the EU-JAMRAI's sustainability report will bring all of this together. It will reflect our collective efforts to provide a concrete roadmap for member states to carry JAMRAI's outputs into the national action plans. So in short, we would like to emphasize that sustainability is not an afterthought, and I will use the image again, but I will say it is the backbone of how we ensure that this work continues to deliver impact even beyond the project duration. So I will now, thank you. I will now give the floor to Benjamin to wrap up on this.
Thank you, Marie. Just to be reassured, I think this is the last slide we do have. And right now, this is not anymore the doctor that will speak, but the researcher. And today I want also to discuss with you about translating theories to action, which are composed and based around 3 pillars. For me, to basically fight antimicrobial resistance, we must translate scientific knowledge into targeted action. And I think that all of you will share this opinion also. First, you do have on these 3 pillars the public authority that you can see on the slide, with needs that are clear, brief and concise policy briefs, and dedicated reports to guide national strategy. Second, you have the scientific community, which rely on robust evidence-based medicine, through guidelines and also peer-reviewed publications. And finally, the general public, which is ultimately the combination of these 2 worlds and need accessible, simplified message to turn that complex science into daily behaviors. And that's actually what we saw during the COVID pandemic. So by adapting our communication to these 3 audiences, we ensure that AMR actions are understood, adopted, and very impactful for the largest audience as possible. So about the power of scientific publication and dissemination and timestamping. Here we have a very powerful illustration of why publication and publishing in high-impact scientific journals really matters. On the left, you see the famous 2014 O'Neill spiral, which was made, I think, by a UK publisher. A simple and very visual estimate massively disseminated its reports, and we illustrated the expected number of deaths of 10 million by 2050. If you do remember, before we just saw that we were on a different timeline, and actually this is the good news. The newest estimations are lowest. This figure was massively disseminated through reports, media, policy briefs, and conferences, and it became the global reference for more than 10 years. Why? Because it was published, shared, stamp with a clear date, and it was established for a forecast in 2050. So if we fast forward on the right part of the slide to 2024, a new landmark study in The Lancet gives us updated estimate based on the latest data, and I think Cecile illustrated that on our first slide. 39 million cumulative deaths directly attributable to bacterial AMR between 2025 and 2050, so approximately 1.9 million deaths per year until 2050 with this new reference scenario. Now everybody is talking about this 39 million of deaths and figure, which for exactly the same reason before. A strong journal, excellent dissemination, and a clear publication date and forecast. That's why our joint action and our effort is very important, and we must encourage everybody to disseminate as much as possible to serve as an official timestamp of our efforts. And thus, we must regularly refine and reevaluate against the latest consolidated evidence we do have in our project. So, first of all, I want to thank everybody for this collaborative work and all your efforts that allowed us to achieve this work in the Lancet Regional Health Europe in 2025. This slide highlights how evidence we generated through the JAMRAI 2 is coordinated around the One Health approach strategy, and it does not remain confined to reports, but truly and actively helps to overcome the silo we just discussed earlier. It is translated into communication, policy engagement, and concrete actions that help to tackle AMR across Europe, reaching stakeholders and even the media to raise awareness among the widest audience as possible, as just illustrated. Once again, I would like to thank everyone who contributed to this collective effort, which resulted in this high-impact publication visible and accessible to all. And I can also add that this paper will be showcased in the ECMID conference in Munich next April. Thank you, and I give the floor for closing, I think, the session to Corine.
Thank you, Benjamin. I think it's very obvious that we are driving our car. We have taken you along for the ride, and we hope you enjoyed it. And before I give the floor to you, because we really want to hear from you as well, we're not just talking at you, we want to have a conversation with you and a discussion with you on what you have just heard. And you've heard a lot about policy implementation, the playing field that we are working in, the support program and the tools that we have at our disposal. You've also seen that we are evaluating the work that we are doing. So we're not just moving forward without reflection, but we really want to see where the impact is and where we need to steer the car into a different direction. And also, you've seen about how we are planning to make our work live past 2027 and to make it sustainable. So what are the main takeaways? You've heard them before. The foundation has been laid, the backbone is there, the brains are here, the budget is here, the know-how and the energy. So there's really nothing stopping us from implementing our work, and also to prove the predictions for 2050 wrong. Thank you very much. I would like to give the floor to the room. Are there any questions? Are there any ideas? Are there any challenges to what we have just presented to you? For example, the people in the room that are using the support program or that have participated in the focus groups, are there any things that you would like to share with us now? We have enough time before we break for coffee, so don't be shy. This is your moment.
Maybe I can.
I can't see any hands actually, so it's very difficult to see anything.
So please shut up if you are.
If you are still alive and awake, I know it's very hot in here, and it's even hotter here.
I can start with the first question.
Yes, do, yeah.
Can you hear me? Yes?
You want to stand here?
I can start with the first question. Can you give us more details about all you have built with the support program? Because maybe some partners do not know yet what they can use and implement. So can you give us a few details about how is built the support program?
Absolutely. So the first year of JAMRAI, what we focused on was trying to get a very good idea on the needs that the countries have. and where they want to sort of, in which direction they wanted to move. So we identified priorities. We call them policy priorities because we are obviously in JAMRAI trying to implement more at the sort of policy level and in national action plans, also using obviously the know-how from the other work packages. So with these 2 policy priorities per country, we've asked the liaison officers, but in collaboration with all their colleagues in the country, because they can't do it on their own, to make a roadmap. So to really think about, you have this priority, where do you want to end up at the end of JAMRAI, and which steps do you need to take to implement this? And so we've chosen 2 because you can't do everything. And with these policy priorities, we have made working groups within the support program, and we have grouped countries that have the same needs and the same challenges. And we have also linked them up with sort of like, we call them good practitioners, so countries that have maybe already partly solved the issue. And so we're trying to exchange best practices here, very much also aware of the national context. You can't just take one practice and implement it in another country. But enabling the discussion about this and to really come up with practical suggestions is what we're trying to do in these working groups, as one example.
Thank you.
Christine.
Thanks very much. Very, very interesting. Just want to hope that DeLorean runs on clean, renewable energy, electric. That's where we need to be. So I'm just curious about, we know that financing is a big problem.
Yes.
Do these national action plans have to cover human, veterinary, and environment? Because we know we have limited resources. So is the work that you're doing enabling that prioritization?
That's a very good question. We hope that the policy priorities that we have on the table are the ones that the countries want to focus on. So we are basing ourselves on that, because what else can we do? But obviously 2 is not enough. You can't do everything, but you also have to do more than 2. But we wanted to keep it achievable, and also knowing that the outcomes of the more technical work packages also require policy implementation. So I think by the end of the day, and you've seen what we're trying to do in the other work packages as well as sustainability, we will have maybe 8 priorities that we try to focus on, but all of this without maybe extra funding. So it has to be found, we need to find a way of implementing it without maybe the political commitment and without the funding. So this is our big challenge, and I don't have the answer, but at least we are putting our brains together to try and achieve that. The answer's here, yeah.
And remind that in one publication, Benjamin told about publication, in one publication they really showed that there is a direct correlation between the approval by the government, the fundings, and the mortality rates. And so more you have an app government approved, more you have an app funded, less you have deaths attributable to AMR. So
Absolutely.
I think it's a direct correlation that should help us to have fundings, hopefully.
Yeah, and also I think the bottom-up approach is very important. So this is also what we're trying to advocate. It might not be something that works in your national context, but it's worth trying. If you don't have the top-down push that we're getting from the Commission, they're helping us, and we're trying to get it through other things. But if you don't have it, try it from the bottom up at least, or do both. I mean, there's no point trying both, and trying to create that policy window in a different way.
Yeah, that's exactly what Anna raised in her talk about the bottom-up approach, yes. Are there questions?
Yeah, I just want to make a comment over here. I'm Sarah Ernst Blomqvist from ECDC.
I don't know where you are.
Hi, can you see me? I'm over here, I'm waving.
Okay. Okay, we see you.
Hi. I just want to say a huge thank you for these inspiring presentations. I really liked the last slide where you focused on how to reach the different target audiences. So you have the policymakers, you have the public health professionals, where it was very clear. It was maybe a little bit less clear in this presentation about how to reach the health professionals and the general public, but I guess that will come in the communications part as well. But just in here, I wanted to also pull in the reference from Anna Karin's presentation, which I thought was really great, because I also used to work in the Swedish Public Health Agency on this program, Antibiotics Part Sweden. And one of the approaches that they are using is to develop these criteria in all the different sectors so that everybody in the whole of society has a list of actions to take in order that they can be certified then as antibiotic smart and get a certificate and an award for this. And I think that maybe within the EU-JAMRAI, we don't have to create everything ourselves. We can look outside to the countries and to the whole system and see which great projects in maybe the gaps that we have could we bring in to help us to achieve our objectives. And I think Antibiotic Smart Sweden is a great example. I'm sure there are many others as well. I hope that's helpful.
Thank you for that. Yes, I think also in the coming days you will hear more about certification, but also how we're trying to implement things more at the national level from the technical side, so the stewardship, the surveillance, etc. So thank you. Any other questions? I see.
Yes, there is a hand raise. Yes, just over there. Can you present yourself because we cannot see anything?
Yes, Diana Teixeira from Animal Health Europe. I'm very interested in your work on indicators and measures of progress. So I would like to ask you if you already have an idea on how to go about that, if you have examples to share. Because one of the things that we have been looking at specifically for the European Commission Sustainability Dashboard is the SVAC and now the user-vet data, but they are not really comparable between themselves. So that's something that we're looking into, and we also don't have an answer to politically measure progress, but we would like to have one.
Yes, we, as I've said before, we identified. I mean, all the teams in the work packages in the project define their indicators at the beginning. So we have this monitoring process, but we haven't started extracting live data from these indicators. We are reporting. All of us are reporting on these indicators, and some of these are concentrated on the more technical work packages. So I hope that many. I expect that some in the coming sessions in the annual meeting, they will show some of these more specific indicators. So our aim here as evaluation, as I said before, is not only reporting, that of course, but how to show somehow the impact that these indicators have, these activities have. So, but specifically regarding your question, I do not have yet more data, concrete data to show, I mean, not together with me at least. Sorry about that. I mean, we can talk later and have your contact and we can talk about that.
Any other questions? Yes, over here. We have, I think, time for one more question, according to the clock that I have here. 5. Oh, we have 5 more questions.
Thank you so much for all the presentations and this overview. My name is Diamantis Plachouras from the European Center for Disease Prevention and Control. I was also very interested about the monitoring and the indicators, and I was wondering, because I mean, eventually we heard very clearly that our eventual target, our eventual aim is to see decreased antimicrobial resistance. So I was wondering how much the indicators of the Council recommendation and the targets have informed your work, and especially in the national action plans. And also, of course, until 2027 is very close to see probably a significant decrease in resistance, which is our final target. But how much have these indicators been used, or how have you been considering them in your monitoring process? Thank you.
I mean, the indicators related to the country recommendations, you mean? So, yes, all the work packages, when defining these indicators at the beginning of the project, we encouraged all of us, and all of us took into consideration these recommendations. So, I mean, I do not have any data on how much of them are reflected on these indicators, because many of them, we have quite, let's say, many process indicators, so how we are proceeding during the project. And now with this reflection methodology I was explaining before, the aim now is to reflect more on these more real outcome and impact related indicators, and also related with the impact and ambition we define at the beginning of the project, including those EU Council recommendations. So now this is the work that we are proposing all of us to do in the coming months. So I invite you all to the next annual meeting, where we expect to be able to present more specific data related to this, how we incorporate those in the indicators. Thank you.
Maybe to respond to the National Action Plan part of your question, the targets from the Council recommendation are not objective as such of JAMRAI, but of course our collective efforts are working towards better surveillance, they're working towards better access, and they are working towards better infection prevention and control and stewardship, as well as better policies, which are all underpinning factors for working towards improving these targets. So I think it's a collective effort. We have not as such focused specifically on these targets, but I think not as JAMRAI, but I'm sure the countries themselves are very much aware of these sort of numbers that are turning red across Europe. Thank you. Johan? No.
Just a compliment regarding this question. The coordination team and the communication team are also working on a midterm report to try to put the recommendation in perspective with some of the first outcome of JAMRAI. So this report will come in coming months. We are working on it with the COM team and also the Commission. So hopefully this document will help linking JAMRAI outputs to the recommendation. So yeah.
It's a very good addition to that. Thank you. We have time for more questions. There's one up there. One?
Good afternoon, everyone. I'm Lucie Cato from the Belgian Public Health Institute, Cienzano. I would like to thank you for all the presentation and shift from the indicator topic to the policy priorities that were identified. I would be curious to hear if you could share briefly with us the top 3 priorities that you identified during that 2 years.
The top 3? Oh, that's a difficult question. Yeah, we have 6 working groups. So we have, formalizing intersectoral coordination mechanisms and moving towards a One Health National Action Plan is one working group. I'm going to need the help from my team in a minute. Making national action plans operational and measurable is the second one. The third one is including environmental and agricultural sectors, so the other One Health partners, because a large part of our members are from the human health side. So how do we talk to the other side in a way, and what is in it for them, and how do we get them on board, if you like. And then there's 3 more topical working groups on surveillance, IPC and stewardship, but specifically on how you set up governance for those 3 topics. So not just a technical side, but more how do you link, for example, the stewardship, which usually happens at the local level, to the level of the governance and the policy side. So those are the 6 priorities, I think, that we have grouped. Thank you. And by the way, there is info corner on the support program and the work that we do with the coffee and hopefully some iced water to be. Oh, it's going to be here. Ice cold water to cool down.
So now, yes.
Thank you very much.
Thank you very much, Corine, Nerea, and all the team.